Hello and welcome to the MOIS training for student nurses video. The purpose of this video is to go over how to use MOIS, what it's used for, and how to complete the different tasks that you might use MOIS for in a clinical setting. It'll cover a variety of different topics. It'll include scheduling in MOIS, using the workspace, which is a tasking and messaging tool within it, and also, of course, doing charting. So with that, let's get started. MOIS stands for Medical Office Information System, and it's used in a variety of different clinics across Northern Health as well as private clinics. It was made originally for a physician's office, a private practice, and it's kind of expanded from there. As you can see on my screen right now, for Citrix Receiver, you can see a variety of different MOIS, we call them instances, that we have within Northern Health. These belong to different clinics. Obviously, we have the Mackenzie Primary Care Clinic, MOIS, we've got Lakes District, Hudson Hope, etc. The MOIS that you will most likely be using is called Community MOIS. And Community MOIS is used across Northern Health by a variety of different services, clinics, programs, and it's kind of the one that's ever growing by the day. Now, when we say MOIS instances, we say that because when you think of MOIS, it's not all just one program. So Community MOIS is a separate entity from Lakes District MOIS. They both are going to have different sets of clients in there, different lists of providers, user accounts. If you had access to both Community MOIS and Lakes District MOIS, again, it would be different login information. So although it's the same program and it functions the same, they do not talk to each other. They are separate entities. And say if one patient has a chart in Community MOIS, the Lakes District MOIS may or may not have a chart in there for them. If they do, it's going to be a whole other chart number. Now, what I'm looking right now is at the Citrix Receiver. It's showing me all the different instances of MOIS that I have access to. Obviously, I have all of them working in training. You will just see the ones that you have access to. So again, if you're working within Community MOIS, you'll see probably just the community one. If you're working in a variety of other MOIS instances, you would have those in here as well. If you're unfamiliar with how to get to the Citrix Receiver, you can go to the bottom right-hand corner of your screen in your toolbar where you have the little up arrow. You can click on that up arrow, and then there's this gray little circle. If you double click on it, it brings up the Citrix Receiver, and you can browse for that instance of MOIS. You can also, if it doesn't show up initially on this page, there's a plus sign to the left-hand side here. And if you go to all applications, again, it's going to give you a full list of all your Citrix applications. You might also get it put onto your desktop. So you might also see an icon for Community MOIS there. So for the purposes of this training, I'm going to head into MOIS train. So I can actually search up here as well. Just type in train. I'm going to click on MOIS train, and it's going to bring up my login screen for me. Now when the login screen opens up, it's going to pull in your username automatically. So you can see here it's put my username in. Now that's based off of who's logged into this computer. So if someone else is logged in, it's going to put their username in there. So my username is going to pop in there, and then I'm just going to type in my password. Your password is generally given to you after training via email, or depending on how your passwords are being distributed to you. If you ever forget your password, you can always call the IT help desk, and they can do a password reset for you over the phone. So I'm going to go into here. I'm going to type in my password, and it's going to log me into this instance of MOIS. So again, this is the MOIS training environment, so we're not looking at any real patient data here. This is all made up clients, made up doctors, everything in here. So I'm just going to expand it so you can see a little better there. Okay. Now, once you are logged into the program, you can go ahead and start clicking into whichever module you want to start with. And the first thing I want to bring into your attention is how to get help through here. So if we go to the very top toolbar, there is a little icon up at the top that says help. Now there's a couple of really great links you can go to through here. The first one I want to talk about is Confluence. Now Confluence is an internal website that is used for a lot of documentation. So you can find lots of different help, how-to guides for how to do things in MOIS. So it's a really, really good resource. So you can just click on Confluence. It's going to open your web browser. Let me just put that into Chrome because it tends to work a little smoother there. So there we go. And this actually opens up directly to the MOIS user guide. And you'll see a list of how-tos. So how to blend a workspace, how-to encounters. There's also standards that are listed here. So these are Northern Health standards for each of these different things. And then you've also got additional documentation standards. So things like the core data set for home and community care and the core data set for mental health and substance use. And you can simply just click on these links and it will give you all the information you could possibly need here, including screenshots, a lot of step-by-step how-to guides there. Confluence also is really easily searchable. So if you're looking for a particular topic, if we go to the right top-hand corner where it says search, you do have the ability to type in here and just search for, something you're looking for. So maybe you want to know, maybe you're working in mental health and you need to know about the core data sets. You can type in, let's just do MHSU core data. I'm going to hit enter. And you can see right here up at the top result is the core data set for MHSU. I can click on that. It's going to open to that page. And then maybe if I want to go back to the how-tos, and I want how to, and we'll do appointment. So again, I'm just typing in there. We'll do MOIS. Go. Okay, so now I'm back at the how-tos. You'll also see on the left-hand side, you kind of have a list of additional how-tos. And again, you can click on these to look at your how-tos. Again, with lots of screenshots, step-by-step, how to do things here. So that's a really good resource. That's called Confluence. I recommend saving it to your favorites. Again, a really, really great resource there. Another resource I want to point out to you is the MOIS user guide. Again, that is through the help menu here. So the very top option is the user manual. This is our vendor site that actually creates MOIS and actually does the programming, updates it. So this isn't going to include Northern Health standards, but you can, again, it's going to give you step-by-step how-to guide for each of the different modules. So it's laid out much the same as MOIS itself. So if I have a question about the patient chart, I can click on patient chart. Maybe I have a question about measures, I can click on measures. And then again, you can jump directly down to, say, show history. And there again, it's going to show me exactly, step by step, with screenshots, how I can use the show history function. So that, again, that's another really nice resource that you can use for help. And then, of course, if you ever need additional help, you can always call the IT service desk and log a ticket. And we do have the training team who can get back to you and help you out. Okay. Now, just talk about a little bit about the modules and some basic navigation, things that you'll see quite a bit in MOIS. So often we'll refer to the different sections in MOIS as modules. And to get into each different module, we want to look down here at the left bottom corner here. So currently I'm clicked into the module called Patient Chart, and you can see all my folders down the left-hand side have to do with Patient Chart. You've got the Workspace module. Again, if I click into that, you'll see my folders change, and now it's more like kind of an inbox. So the Workspace in MOIS is basically a way of internal communication with other MOIS users. So you can send like a message attached to somebody's chart in a nice secure way to another MOIS user in this particular instance. So again, keep in mind that this doesn't talk to other instances of MOIS. So if I'm in Community MOIS, I could only send something to a user in another user that's in Community MOIS. Another module that you'll use quite a lot is the Scheduler. So the scheduling component in this EMR is combined with the actual charting, which is nice. So you can actually open a schedule and start charting from a patient appointment. There are additional modules, although you probably will not be using them. Billing for sure not. It's generally used, again, by physicians who are doing billing out of MOIS. Administration, again, just generally administrators, IT have access to that component. The data exchange, usually clerical staff have that, just to do things like scanning documents directly into MOIS. And reports, those are available to everybody if you need to pull a report on basically any kind of data in MOIS. Okay. Now, one thing that will pop up the first time you log into MOIS, you'll see this screen here. Okay. So you're going to get this little window that comes up, and it's going to ask you to select one of these. Okay. Basically, it's asking you to select your desktop for or your default desktop provider. Okay. So this is where we're going to get into talking about orgs, which is short for organizations, org roles, which is short for organization roles, and providers. So basically, instead of everyone having their own name as like a day book, we are using something called org roles. So you might maybe as a student be working with, maybe your preceptor is linked to PCIPT1 Nurse 1 PRG, rather than her name. So the reason for this, things like connections to this role, daybook for this, it's all going to be this generic format. What that helps with is, say this nurse who is currently occupying this role leaves, it's going to make it a lot easier for us to add a new person to that role and take over all those connections, all those appointments, and again, it's not going to be under someone's name. So that's an example. This here is an example of an org role or organization role. So it's a role that someone is filling. It can include multiple people. So sometimes we do have ones that are casual, that just the casual pool shares. This is just the general format. So it starts off with the team type or name. PCIPT, what you see here, just stands for Primary Care Interprofessional Team. Other common ones you'll see is like mental health, so MHSU. RM, that's Rapid Mobilization. So it's generally the team name that comes first. Then again, if there's multiple teams, we just start at one. Then it's going to be the role that they're filling. So that could be nurse, that could be social worker, it could be respiratory therapist, and so on. And then we just start with number one, and then the short form of the city. And then again, if we have another nurse that's that same role, but again, they need their own org role, then they're going to be nurse 2, and so on. Okay, so those are our org roles. If you want to see who is associated with the role, there is this view members blue link that you can always click into, and it will show you if there's a name associated with that. So that one doesn't. Let's look at, again, also, sorry, you don't have to scroll. You can search up at the top. So if I search for PCIPT 1 Nurse 1, and here's Nurse 1 PRG, view members. So I can see we have 2 people associated with that role. You can see the start date that they were added, and if they have access to the task list, the message board, and the basket. So that's another nice thing about these org roles, is they also have their own workspace. So again, if, say we have a casual pool that gets daily tasks, and you're not sure which casual is going to be working, whoever's tasking them could just send a task to, say, this org role, and whoever's covering will be able to see that daybook and can check off that task. So again, it just helps facilitate group work, teamwork. It just eases a lot of the issues that sometimes arise with assigning things directly to people's usernames. Okay. The other thing I mentioned before org roles was orgs, or organizations. That's generally the team name. So if I look at, I'm just going to get rid of this one here. So you can see here the type as well in this column. So the team name is generally just the team and then the location. So here's team, the ACT team, PRG. For IPT, again, if I search PCIPT, up the top, and I looked for, let's just do PRG. There's the team, PCIPT 1 PRG. And again, you can still view the members. Generally, you'll see a list of all the different org roles that have membership to that team. And again, you can see the name that's associated with it. And again, if they have access to the basket, the task list, and the message board. If you see anything grayed out, that just means that they no longer have access. So they have been end dated. So that person was once associated and had membership, they no longer do. And the last type that you'll see here are the provider type. Generally, the only people who get the provider type are physicians, NPs, or certain nurses who have MSP ordering rights. And those ones are the actual name. So we have Dr. Hauser here. If we just check off just to show the providers. So this is what you would see. You would see the person's actual last name, first name, and they're associated obviously with themselves there. Okay. So how does this apply to you? Well, it all depends where you are working. Generally, your preceptor or whoever's working with you will let you know which one you're going to be selecting. So often you will select whatever your preceptors is. If you're sharing, you're looking at their daybook appointments, it just makes sense. Or if you do have your own. So what you can do is just search for it here. So I'm just going to do, again, that one that I started with, PCIPT 1 Nurse 1 PRG. And to select it, you can just double click on it here. Or if you want to save it as your default, you can go to the bottom left here, or sorry, to the right where it says save as my default, and hit save as my default. Now what that means is the next time I log into MOIS, it's going to already be selected for me. So I won't see that pop-up screen when I first log in. It'll just log in, and then I'll be able to see that up at the top right corner which desktop I have selected. So I'm currently on PCIPT 1 Nurse 1. Now if your org role changes, so maybe you work with a different person or a different team, you always have the ability to change this simply by clicking into this yellow box here up at the top. And again, here it gives you the full list once again. Okay. Okay. Now, a lot of basic navigation in MOIS is going to, again, I'll bring your attention to the left-hand side here. So most of the navigation does happen down this left-hand side. So again, depending on which module you have, you'll have different folders that you can click into. Another really helpful link that you will always have no matter what area you are in MOIS is this little blue go to chart hyperlink located at the very bottom left hand side. I know it's getting a little bit cut off here at the bottom, but it says go to chart. Now, no matter where you are in MOIS, this will be available to you. And if you click on to go to chart, this brings up the chart lookup. So here you can search for a patient chart and actually bring it up from here. Now you might not have to do this all the time because any booked appointments in the scheduler, you'll be able to open the patient's chart from there. But again, it might be like maybe you don't have the appointment booked with the patient. Maybe you need to look something up on them or follow up. So that go to chart link just always there at the bottom. Searching in MOIS. So it's pretty consistent with a lot of these little white filter boxes located up at the top. So you'll see that a lot in MOIS. Anytime you see these, whatever it's directly above, that's an area you can filter your results by. So you can see you can search by, we've got last name, their first name, date of birth, home phone number, their MOIS chart number, that would be specific to the instance of MOIS that they're actually in. Alias, if they go by a different first name other than their legal name, which should always be in this section. And then insurance by is going to be their BC PHN. Although occasionally we do see out-of-province IDs in here if they don't have a BC PHN. Now you can do partial searches. You can do partial searches over multiple windows. And just as you tab over, it's going to start actively filtering your results. So if I say click into the last name search window, and I just type in CO and hit tab, you can see it's automatically filtered my results to just last names that have a CO together in them. And then it's went into the first name field here. So then I can search for B. Again, enter. So again, partial searches are fine. The recommended way to search for somebody is always their BCPHN. So that is considered the patient's only unique identifier. So that's always the way to go if you can. Now we understand that a lot of times you won't have that, but that's just what is recommended. And before you open the chart, just make sure you confirm that this is the correct patient, verifying things like the date of birth or phone number. Again, PHN, that's a recommended way. And to actually open the chart, you just have to double click anywhere on that highlighted line here. Okay, sometimes you might get a reminder box that comes up here. We'll go over later how you can create these yourself or where they actually are created. Just have a look over what's in here before hitting close. And then it's going to make that the active chart. It automatically takes you into the patient chart module. And here you can see Betty is now our active client. So each of these folders down the left-hand side belong to Betty. This is going to remain your active chart until you either exit out of the program or until you bring up a new chart. So you can actually go to other modules like your scheduler or your workspace. And if you click back on the patient chart, you're still going to have it open to that chart. Okay. Now, another thing that you'll see a lot in MOIS is what we call the ellipsis or the search button. So a lot of places, let's just find one where there's search. So right next to, for example, next to chart number here, there's a little box, and I know it's kind of tiny and hard to see, but there's 3 little dots inside there. Anytime you see a box like that, that's going to indicate if you click on that, you're going to get some sort of list to choose from. And the general rule of thumb in MOIS is if you are entering some kind of data and you do have one of these little ellipses, one of those search buttons available, that's what you want to click on and search for and select from so that it is coded data in the system and it's going to be much more meaningful to the chart than if you were to say just free type something into a blank line here. Okay, so that you'll see that recurring quite a bit. Those 3 little dots, we call it the ellipsis or the search button, and again it's going to bring up some kind of list for us to choose from. Another thing I'll point out is the toolbar. So there's generally little toolbars within each folder. Again, this changes depending on which area in MOIS you are in. And then the same goes with your top toolbar. Okay, so if you ever have an issue where you're looking for something and you just can't, you know it's in action but you can't find it, maybe just check which area of MOIS you're in, because not all features are available in all folders and in all modules. Okay, so let's dive into the scheduler now. I like to go into scheduler near the beginning just because it's kind of where most people start their days from. You look at the appointments you have booked, and you can actually do a lot of your charting right from the scheduler module. So to go to the schedule, I'm going to click on the scheduler module on the left hand side near the bottom here. Now when you first open this, it's going to give you an overview of all the different schedules. And if you're working in community MOIS, there will be a lot in here. You can directly open the corresponding daybook on the right hand side, but you're going to be scrolling for a while. So what I would recommend is, instead of scrolling through this big long list of daybooks, simply click on the first folder up at the top left hand side that says daybook, and that will take you to your default. So because I had my default desktop provider selected up here to PCIPT 1 Nurse 1 PRG, and this is also set up with a daybook, when I click on daybook, it's going to take me to that daybook first. Okay, so that's going to make life a lot easier for me. If you need to look at a different daybook or you're taking appointments from another daybook, that is fine. You can always change the daybook that you are looking at by clicking into this little box here, little drop down window that says daybook 4. And again, here's my full list of all the daybooks. So say if I'm actually covering for Nurse 2, I'm just going to type in Nurse 2 PRG, PCIPT, there we go, Nurse 2 PRG, okay, and now I'm looking at Nurses 2 daybook. Okay, and again, if I want to click back, just click on that once again. You can search, you can scroll through, whichever you prefer, double click to add. And now I'm looking at day 1. Now you can see right here, I don't have any appointments booked in for today. So we're going to go ahead and we're going to book in an appointment. Okay, so first of all, the first thing you want to do is make sure you're on the correct day. It will default to opening to whatever the current day is. So you can see right here, I'm looking at the daybook for Tuesday, June the 9th. If you're booking for another day, you have a couple of different options to getting to another day here. You have these buttons here. So this little single arrow will go forward 1 day, or it'll go back 1 day. The double arrows are going to go forward 1 week, or back 1 week. And the today button, of course, is going to take you back to the current date. You can also click into the date field here, and you can type in the date that you want. So the date fields in MOIS always go year first, then month, then day. And then I'm just going to hit enter. So now I'm looking at June the 30th. And another really nice feature is what we call the hotkey for the calendar here. So another thing that I'll bring up a couple times throughout the session is the MOIS hotkeys. Basically, they're just a shortcut key to bring up some kind of function. So a really common one is F4, so the function key at the top of your keyboard, F4. Now the F4 key we call the prompt key, and the reason for that is it does do different things depending on which area in MOIS you're in. So if I'm clicked into a date field in MOIS, it's going to bring up a calendar for me. And this is a really nice function because then you can just click on the date that you want. Again, that was just F4, or you can scroll to other months. And again, just select the date that you want. Okay. So that's F4. Another nice feature in the date field, and again, this will work in any date field. If you do Control T, that always gives you today's date. That's a really nice one for charting if you're entering something that's just you're entering today. Control T another really nice hotkey. So let's go ahead and book our first appointment. So we're going to go to the top of the page here, right above the date field, and click the new appointment button. And you'll see here that you'll get a new line that appears, and we're just going to fill out this orange colored line. So we're going to start off with the time of the appointment, so the time that it starts. So HR means hour, MN means minute, and it is in 24-hour clock time, so keep that in mind. So I'm going to say I'm booking this for 3 p.m. today, so I'm going to do 1500. Next, I'm going to select my visit code. If you're on site somewhere, you probably will see a few of these big colorful placemats with all the different visit codes on them. It kind of gives suggestions on which visit code you should be using for what type of appointment. Our really common ones, routine visit, long assessment, those are quite common. The general rule of thumb is to kind of stay away from the ones that are location-based, because we now have a section in the datebook called service location where we can identify where it's taking place. So if it was a home visit, instead of choosing home visit here, we're going to choose probably long assessment or maybe a procedure here. And then in the service location, we'll indicate that it took place at home. Okay, so I'm going to say this was a long assessment. I'm going to select that. And the next column we're going to fill out is the visit mode. So this is the format of the appointment, so how it took place. There is direct encounter with client alone, client in a group, third party, and if you scroll down, you have additional options including mobile messaging, online call, telephone visit, telemedicine. So again, just make sure you select whichever one makes the most sense. So again, if it was a telephone visit, telephone. I'm going to say that this was with the client alone, and it was a direct encounter. And the next column we're going to fill out is the visit length. So visit lengths in MOIS go by 5-minute intervals. So a 1 here would be equivalent to a 5-minute segment. So 4 times 5, this would be a 20-minute appointment. This you can see populated in there automatically. That's just based on the visit code. That's just the default, but you can always change this. So I'm going to say that this was actually booked for an hour with the patient. So an hour is going to be 12 times 6, of course. Sorry, 12 times 5 is our 60-minute appointment. Next, we're going to book in the patient chart. Now, you want to make sure you click the little ellipsis, so the 3 dots here in between chart and first name, and that we're searching for the patient chart and selecting them from this chart list. Otherwise, the patient won't actually be linked to the appointment, and we won't be able to chart on this encounter. So never free type in a first and last name here. You always want to go ahead, click the ellipsis, and we're going to search for the client. So like I mentioned near the beginning, insurance number, aka their PHN, is the best way to search for somebody. And again, you do have additional search fields that are available to you. So I'm going to say we're looking for Betty here. To select, again, you can just double click on the name. Again, just have a look at those notifications before hitting close. And now you can see Betty's first and last name populates into this line along with the chart number. And the next area we're going to do is the visit reason. Now, this is one of the few areas in MOIS we generally don't click on the ellipsis and search for. The reason for that is if you choose this, it tends to be just a list of diagnostic type codes, and rarely it fits into the type of visit reason you actually need to enter. So one thing we encourage you doing is using something called snippets. Now what a snippet is, or a snippet code, is basically a short form of text that you can enter into MOIS, and it's going to give you a longer string of text. And it just helps to ensure a certain visit code is, or visit reason is entered in the same way each time, and that it's spelled correctly. So again, snippets, there's a list available on Confluence. Also, there's a lot kind of floating around a lot of the clinics. They all start off with a backtick, or what we call a grave symbol. It's right below the escape key on the top left-hand side of your keyboard. So you'll see that little kind of squiggle with the little back tick on the same key. So it's the back tick first, and then it's what's called the snippet code. So if I typed in, say, MHSU1 and hit tab, you can see psychiatrist consult has populated into the visit reason. Okay. You can also free type in a visit reason. Just keep in mind that we want to stay away from anything too vague. So putting something like follow-up is not a good visit reason to put in. What is it a follow-up for? So I'm going to say maybe this was for a dressing change. Also, we recommend all caps, just as a standardized type thing. Dressing change. Next, we're going to enter in our service location. And again, there will be quite a long list in Community MOIS that you'll see. We do have a lot of locations. Some will look like duplicates. So you might have, for example, for home visit, you'll see you have home, and then you have a home-AC. The ones with AC stands for automated callout. So basically, this is linked with some software that we use called Infinite Voice, which will notify the patient 2 days before their appointment that they have an appointment. Okay. Now, you might be working at a clinic that is not using Infinite Voice. That's fine. You still do need to put in a service location. So I'm just going to choose the generic home one. Because I'm booking this today, anyway, they wouldn't get a call because it's not 2 days in advance. And then we're just going to go ahead and save this. Now, save usually always up at the top of your screen in MOIS. There's a little save button up top here. And if you prefer to use your hotkeys, F2 on your keyboard is also save. So that's another really nice hotkey to use. You can see once I've saved it, I have a little colored bar that appears up in my top time grid. And it kind of blocks off that time. You can hover over it again to see the details of what's booked in there. So now that appointment is booked, we're good to go. We can actually chart on it. Now, other areas you might see in here, things like resources or rooms, sometimes used. The important one to look at here is the AS, or appointment status. So most clinics, they do have the clerical staff putting when the patient is arrived. So if we see, say, an A here, I'm just going to close this again. That means they've been marked as arrived. And there are also options for no-show, rebooked, or canceled. Those ones actually cross the appointment line out. Okay. And generally what the clinician, so you would be responsible for, is marking the scene and the discharge times. You can do it here, but it makes much more sense to actually do it through the encounter window where you're doing your charting. So there's another quicker way also of adding it there. So I'm just going to mark them as arrived for now. Okay. Now, other features you have within the daybook, you can do what is called a quick registration. You can do things like travel time. You can also create miscellaneous time blocks. So travel time, so if you are in a clinic where you have to track your travel time and you guys are doing that in MOIS, you can do that. It's just like booking any other appointments. The only difference is you're not actually going to link it to a patient chart. Okay, and there's actually a little visit code that's called TR for travel time. So this is a home visit to Betty, maybe, so I'm going to book the travel time to her house and then back to the clinic or maybe to the next person's house. So to do that, it's the same process as booking an appointment. New appointment, I'm going to put in the start time, so when I'm going to leave. So maybe I'll put in 14:45. Again, you always want to use your correct code. So for this one, it's going to be travel, so TR. The mode, it doesn't really matter which one you choose for this because it's not going to be linked to a chart. So you can leave it as the default. You can also just delete it if you wish. And then just like with the appointment, we're putting in how long we're spending traveling. So if it takes 15 minutes to get to Betty's house, again, this is 5-minute increments. So we're going to put in a 3 here for 15 minutes. Do not link the patient chart. And the visit reason, you can just type in something like travel to Betty's house. And then I'm just going to go ahead and save it. Okay. Then I also want to book my travel for the way back. So I'm going to do my new appointments. I'm going to say we're going to Since my appointment is an hour along with Betty, 1600, again, the same code. So we want our travel time. Again, mode doesn't really matter much here. And I'm going to say maybe it's like 5 minutes to the next person's house. So I'll just leave that as a 1 and travel to next appointment, save it. And again, keep in mind this might not be something that you need to do, especially if you're not doing appointments out of the clinic. And there are still some groups that do book the travel time in their Outlook calendars. So again, this is just something that you might use. Another time block I want to show you is the miscellaneous one. So if you want to book something in your calendar that again is not associated with a client at all, there is actually a miscellaneous time block. So at the very bottom of this code list, there's an X. So if you just want to put something like, I mean, it could be for anything really. I'm going to put maybe for an hour. Again, obviously I wouldn't probably want to link that to a chart. And then maybe I'm just going to put in that, let's see, I'll just put unavailable for now. Okay. And you can see it shows up just like an appointment, but again, a chart is not associated with it. And then a little note just about joint appointments. So if you have an appointment that is booked also with an additional clinician, the appointment needs to go in both people's calendars. So basically that patient is going to have 2 appointments in their chart with 2 different clinicians. Each clinician can do their own charting. And again, just use the correct visit code. So again, whatever is most makes the most sense for that type of visit. Okay, a couple more features in the daybook that you can use. So obviously, delete. So if you have something in here you don't want, maybe you created something in error, there is delete appointments right next to new appointments. So I've done that before. I accidentally made an extra appointment line there. We can just clean that up. Generally, most things you go to delete will ask you to confirm before deleting. You also have the copy and move function. So suppose we have an appointment booked in here. So we'll just delete the appointment status. And we did this, we filled this out, and then we realized, oh shoot, we put this on the wrong day. I meant to book this for Wednesday. So instead of deleting this and then going to Wednesday's daybook and creating it all over again, we can simply do a move. Okay? And you can do that by right-clicking on the patient's appointment and clicking on this option here called copy/move. Now note, you should only ever move an appointment if it is user error. So if this is an issue where the patient has rebooked or canceled, something like that, you do not want to use the move feature, you want to use your status. Okay, so you could do the rebooked or the no-show or the canceled. So we still want to capture those statuses. So this is generally if you made the mistake and you want to move it. So here we choose our new date that we want to move it to. Again, you can use your calendar key, F4 if you wish. So I'm going to say we want to put this for tomorrow. You can change the time. You can even change who the appointment is with. So even if it was on the wrong day book, maybe nurse 2 is actually taking it, you could actually move it to another day book. And then I'm just going to click move. If you copy it, you're going to have 2 appointments. So you're going to have this one still today, and you're going to have another one for tomorrow. Okay, so I'm going to hit continue. It's going to ask me, are you sure? And now I'm looking at tomorrow's day book, and there's Betty's appointment. Okay, so again, that was just a right click, copy move, choose the date. I'm just going to move it back to today to chart on it. And we're going to move it back. Okay. The other feature I'll just show you is something called quick registration. Now what that allows you to do is, say if you're booking an appointment for a patient and they do not have a chart in this instance of MOIS, what it allows you to do is quickly create a chart for the patient and book them into a time slot all in one step. Okay, now you do want to be careful about using the quick registration feature. We do have an issue with a lot of duplicate charts getting created in MOIS. So before you create a new chart, please make sure that you search for the patient in multiple different ways to make absolutely sure that they do not have another chart, or they don't already have a chart rather in MOIS. If you do come across a duplicate chart or duplicate charts in MOIS, just write down the chart numbers only and send in a ticket to the IT help desk. It'll go to the health information management people and they will merge the charts. Okay. So say I'm going to book an appointment for somebody. So again, new appointment. And we're going to tab through here. And maybe their last name is Robertson. And first name is Alfred. So you can see here, I have nothing come up. So again, you want to make sure you search in a bunch of different ways. So maybe I'm going to search instead, I'm going to delete this out here, and I'm going to search by their PHN. So I'm going to get their PHN, tab. Still nothing, okay. Maybe they changed their last name. Let's search for Albert or Alfred. Okay, no, still not in there. Maybe he goes by a different name. So you can see I'm searching for multiple different ways, right? So now at this point, maybe I'll do a date of birth too. So let's do, maybe he's born 1935, April, oh, that's a little early, 1935, November the 3rd. Again, nothing. Okay, so now I can confirm this person does not have a chart. So what we're going to do is use the quick registration feature. So to do that, you have to cancel out of this window. So I'm just going to hit cancel at the bottom here. And I'm going to right click on this blank line. So it has to be an appointment line that doesn't already have someone in it. And we're going to go about halfway down and use the feature called quick registration. Okay. So it's going to give us this quick registration form, and we're going to quickly create them a chart. Now, you don't have to fill out every field here, but there is a minimum mandatory data set that you do have to enter to create a chart. So I'm just going to enter in the minimum mandatory here. So first and last legal name has to go in. You can see here the name format goes F first, then middle, then last. So this has to be their legal name. It cannot be a nickname. It cannot be an alias. If they do have an alias, that can go in the second line here where it says alias. So if he likes to go by Fred, you could do that. So first and last legal name has to go there. Date of birth. Again, the format is year. Goodness. Okay. Year, then month, then day. Their gender. In this window, you just have male and female. Don't try to click on the advanced gender designation here. We do have a little bug where it does crash. So if they are another gender other than male or female, that information can be added after this initial setup. Okay, so you got first and last, legal name, date of birth, gender, PHN. So we want to choose insurance by BC. Again, this should only be their BC care card number that goes into this field unless they don't have one. Then you can do another province ID. So we're going to enter that in. And there we have our mandatory data set. Now, if they do not have a BC PHN or you don't have that information available, you need to put in an address or some kind of contact information. Okay. Now you'll have two address lines. You have the top address line that is intended for the mailing address, and the second one is for physical address. If they only have one where they get their mail and they live, again, always fill out the top one first. So if they live on 123 15th Avenue, we're going to fill that out, postal code, etc. Obviously, the more information you can get on somebody, the better, especially contact information. So it's always good to at least have a contact number here. But the minimum mandatory first and last legal name, date of birth, gender, BCPHN, or address information. Okay. And from here, I'm just going to go ahead and hit register. And you'll see here, oh, we actually have an existing chart with the same insurance number. So if you do have that come across that, it's not actually going to let you create the chart. So what we'll do is we'll just modify this a little bit. 33. There we go. Register again. Has too many digits. Yeah. So one thing that's nice about MOIS is it does have a built-in PHN checker for BC. So if a BC PHN you've typed in isn't valid or there's an issue with it, it will let you know. It still will let you save unless it's duplicate. So now you can see this person has a chart number. There's their first and last name. It's populated into this line. I can go ahead and enter in my visit reason and my location. So maybe this one is going to happen 3rd floor NIHU. And then again, always make sure to save. Okay. So that is my quick registration. Okay, so that is it for the main day book. The last thing I'll point out in the scheduler is you do have different views you can use if you wish. So you'll notice to the right-hand side of the screen, the left-hand side of the screen, you have week view for one provider. So if you want to look at a week view of appointments, you can do that. Here's where you select the day book that you're looking at. So if I go back to Nurse 1 PRG, there you can see my booked appointments. They kind of show up as these colored blocks of time. And you can still book into these. You just have to do a little right click. And then it gives you the create appointment feature. Here is where you can select the chart. And then again, still making sure you fill out the visit code, the date and time, the visit reason. It will kind of estimate the time based on where you've clicked in there, but you can simply click over that and change it if you wish. And then if you look back to the left-hand side here, you do have day view for multiple providers. So what that means, multiple day books. So again, if I want to look at the clerical staff, probably use this more than anyone, but I have talked to a few clinicians who do like looking at seeing what their coworkers do have, if they have availability for different things. So we'll put nurse 2 in this slot, and then we'll put nurse 3 in this slot. Okay. And again, the format looks a little bit different. You kind of have the person's name. Again, you can hover over to get more information, and you can still book in by doing the right click, create appointment, and here's your date field up here. Okay, so those are just your different views. So if you prefer one over the other, you can definitely, there's different ways to look at the same information here. So I'm going to go back to my view here. Okay. Now charting. Now the nice thing about the scheduler in MOIS is as soon as an appointment is created for the patient, it creates an encounter in their chart within MOIS. So it gives you a really easy link to their chart and also a really easy link to open up their encounter and just start charting. So say I'm seeing Betty now, we're going to say that the clerical staff marked them as arrived. Sure, that probably wouldn't happen in a home visit. So let's just make that more likely. We'll say that it's living well. Sure, let's do that. So if I want to start charting on this patient, all I have to do is double click anywhere on their appointment line. I usually just double click on the name. And again, this is going to bring up what we call our encounter window. So you can see here up at the top, it has our patient information, the information for this visit, and it opens directly up to this tab called Progress Notes. So like I mentioned at the beginning of the training, there's a lot of charting that you can do directly from the scheduler. We're not actually in the chart, but we just have this individual encounter open. Now the first thing you want to do is make sure you always enter in your scene and your discharge times, or what we call hours of care. Now you can see here, this is connected to the daybook screen. So as soon as I marked them as arrived, it put in the time as 3:57. Now you don't need to do an in-room, but you do need to put in your scene time. So when you started seeing the patient, and your discharge time, which is when you're finished with the client. So this is tracking your hours of care. It doesn't include things like charting. I know that comes up sometimes. This is just, we want to check how much, or track how much time you actually spent with the client. So I always say it's a good practice to, if you chart while a patient's there, just put in your scene time. You can use this little timestamp button to the right. That's just going to put in the current time. Or you can always just type in the time, which is necessary if you're doing things like home visits and you don't get a chance to chart maybe till the end of the day. Just jot down those times as you go. So I'm going to say maybe we start seeing them at 50, or at, we'll do 1600. Okay. And when we're done with them, we'll do the discharge time. So after they leave the room, we'll do that. So progress notes. You can type any notes you want to type in here. You also have access to something we called progress note templates. So this is another area where we need to use our hotkey. So our prompt key F4, so the same key that we use to bring up the calendar in the date field. If we're in progress notes in this window here and we do F4, we get a list of progress note templates. Okay, so basically just a template to make life easier for you. You can follow a template. This is a searchable list again, so if I'm looking for, maybe if I type in diabetes, or what were we doing this for, wound? Let's do diet. So I just hit enter. So basic diabetes education, sure. So to select one, you just simply double click and it's going to populate that template into the window here. Okay. You can add information if you want. So again, you can type into here, you can cut information out so you don't have to use the whole template. I'm just deleting to get rid of that. And again, use F4 we can use to bring that up. Let's bring one here with our little underscores. So you might see some progress note templates that have these little underscores. What that allows you to do is to jump easily from line to line using your function keys F8 to go forward. So go to the next line. And F7 is going to take you to the previous line. This saves you from having to click on each individual line and start typing. Okay, which you can still do if you prefer. Again, these are just giving you little shortcuts if you prefer. Once you're done your progress note, make sure you always save. So you have save again up at the top of your window, top left hand, or you can use F2. You'll notice when you save, it's going to put yourself as your username as the author who it was created by. You can do things like add new notes. So that's going to give you a brand new page, and you can type in note number 2. Save it, and you can actually tab between the two notes. One thing to keep in mind with encounter notes is they do become locked and read only after 7 days. So if you come back to this encounter after 7 days, you'll probably see that it'll be all kind of grayed out and you're unable to make edits to it. Often the new note button is used for that. So if you have a situation where you need to write an addendum to your progress note and it's locked down, what the process is to just add a new note and write your addendum and save it. You also have delete note. You can only do that if your page is blank. So you'd have to select all of this, delete it, then hit delete note. And again, if it's locked down, you can't do anything to it. Let's move on to our next tab. So next to progress notes, we have measurements. So if you're taking any kind of measurement, this is where you want to enter it. It's going to be much more meaningful to the chart. You can view histories of measurements, see trending data. It's going to be just much more useful to a chart than entering in these measurements into the progress notes where, you know, it's probably just going to get lost. Not, you know, people aren't going to read through encounters worth of progress notes. So measurements, to make the most meaningful, we're going to enter them in the measurements as a coded measurement field. You can enter measurements in several different ways. You have the new record button here. Again, it gives you a new line. You can click the ellipsis and it gives you a list of all the different measurements you could possibly think of. This is going to include things like lab codes, so you do want to make sure you use your search for option. So maybe if I'm doing, let's see, we did a glucose. I can search for glucose. We want to confirm that it's that one that we actually want. So you do have additional details here. Double click to add. And then in the value, you're just going to type whatever the value is. Always keep in mind to check what your units are. Units aren't something that can be changed with the measurements in MOIS, so just keep that in mind. So there's one way you can add them. Another way that you can add them is through the template button. So this button here that's called template, this contains all your most commonly entered measures in MOIS. So it's kind of a pre-made list of just the most common things people enter through the measurements folder. So it's a really quick way to enter in multiple measurements, multiple common ones. So here we have things like blood pressure, height, weight, temperature, heart rate, etc. So you can just go ahead and enter the ones that you took. So maybe we'll do a blood pressure, and we'll do a weight. Again, keep in mind, just check on your units here. So height is in centimeters and weight is in kilograms. And we're going to look at our temperature here. So we want to do our temperature. We've got our heart rate. And once we have the ones we want filled out, we're just going to hit Save Changes at the bottom of this list. And you can see now I have a whole bunch of different measurements I've added with a bunch of different values. Okay. Keep note that there is another button here called Other Template. It's just another list of additional templates that you can use, often for specific reasons. There's one for like mental health measures, spirometry, urine drug screen, and it's the same format as the original template, just a different list of measurements. And again, so you would just type in whatever the value was. Okay, and again, just save changes. Another feature that you can do with measurements is you can add an attachment. So keep that in mind. If you do add in a measurement and there's a form that goes along with it, that's something that the clerical staff can scan in and actually attach to your measurement. And we'll get more into attachments in a little bit here. More features, you can graph measurements. So if I want to graph their height over time, I can click it and hit graph. It's going to pull all the heights from their chart, give me a graph. Has things like your upper level limits and your lower. And one that I really like is the show history feature. So if you right click, you have this feature called show history at the very bottom. What that's going to do is, again, it shows you every time this measurement was recorded for the patient, the date, and what the value was. So again, a really nice way of viewing data, seeing how it's trending. Okay. You also have the calculator, which has things like a BMI calculator, gestational age, etc. I won't go into them in too much detail. They work just as you would think. Type in the data, hit enter. It's going to give you a calculation. And these calculators, a lot of them have a populate button too, which will pull in the information for you from the chart if it's available. And then I just save, and it's just another measurement here. If you see a measurement highlighted in yellow, that just means it's out of the normal reference ranges for that patient. You can see here there's a little flag that says H. You can click into that, and it'll say it's above high normal. Just keep in mind that these flags are not built in for every single measurement in MOIS. So keep that in mind, that you might know that there's a measurement that's kind of, not normal, but it might not necessarily be flagged. The next tab we're going to move on to is services. So right next to measurements, we have services. And services basically capture a client's journey through a specific service. You can have the phase of the service, so there's different phases. There is the initial service, there can be follow-up services, and then there's also discharge services. So the life cycle of a service, what we call a service episode, is going to be one initial service event, probably multiple follow-up service events, and then one discharge event. Okay. Now these are mandatory to enter, Not every single site has been taught and implemented with them yet, so again, this might be something you want to check with your preceptor to see if you guys are entering the services. So to enter a service, and again, this should be done for every encounter, we're going to click the New button, and this is going to come up with a list of services this patient is currently enrolled in. Okay, so currently they've got case management, cognitive behavioral therapy. It has the service MRP, so the most responsible provider, so generally the org role of maybe whoever like the case manager is, the start date and a stop date if it has been stopped. Okay, so if this episode has already been created, you would simply select it and then do a follow-up. But we're going to say that maybe we're doing wound care. So this is the initial wound care service event. We don't have a service episode for wound care, so we're going to create what's called an initial service event. So we're going to go to the bottom of the page on the left-hand side here and click the button that says Initial Service Events. Now the next window that comes up is going to depend on what org roles and orgs you might have membership to. So basically what we can do is if a team just provides, say, a handful of different services, we can add those as their defaults, and it makes life a lot easier for the team members to choose the service that they are providing. So you can see here, I am part of the team CAR 60, 1PRG, and this is the service they always use, so it's on basically my short list that I can choose from. Same deal with belonging to YCOS and EPI. You can see these are the two services that my team provides. Those are the two I can select from. Now, if you don't have membership to a team or to an org role, or maybe your team just hasn't been set up with defaults, what you'll get is what's called the master service code list, which will look like this. So it's going to have all the different services. Now, one thing that we recommend doing, because this list by default does include things like diagnostic codes, which we don't want to choose. We want our service codes that are actually coded correctly as like home care codes or mental health codes, etc. We want to actually choose from these lists that have been built because these are actually reportable to the ministry. So what I can do is if you go to the bottom left here where it says source, you can change your list to just include the NH service code. So those are our Northern Health service codes, the ones that we are using. You can also choose save on close, so the next time you look here, you don't have to select that. It's just going to automatically come up with the NH service codes. So initially you'll probably get everything, and you'll notice there'll be a mix of a lot of different codes and service fee codes, that kind of thing, things that you would never use. So the first time I just recommend choosing NH service, hitting save on close, and then searching for your code. Again, a lot of sites have little short cheat sheets of the type of services that they use. So to open our new service episode, we want to use either an MHSU code or home and community care code. Again, what service we're admitting them into. So if I search for something like wound care up the top, here we have wound care, but it's an ACT code. Now, with ACT codes, those should only be the action that we are taking today. So we want an HCC code or a mental health code. Okay, and I'll explain a little bit more about ACT codes here. So if I think it's home care would probably want to do it under. So I'm going to choose home care nursing. Okay, so I'm going to choose home care nursing. Now you'll see this little event window come up. So here's my org role. If I'm not the most responsible provider, or this is the wrong org role, that can be changed here. Now the ACT code is what you want to select here. So the service episode is those HCC or those MHSU codes. The service event or ACT code, this is what we're doing today at this visit. So we're enrolling them in home care nursing, but what we did today was home care. was wound care. So we're going to click the ellipsis and we're going to search for, again, master lab code or master list. So if I do wound care, there's my ACT code. If you think of it like ACT is the action you took today, that might be more helpful. Wound care. And next we just want to put in the health issue. So basically the reason why this service is being provided. So I'm going to click new health issue. I'm going to click on the ellipsis and I'm going to search for wound. Search that. And we're going to add that to my list here. And then we're simply going to go to the bottom and hit save. Okay. So now I have enrolled this person in home care nursing services. This was the initial service events. And what we did today, the action was wound care. Now you can add multiple actions or multiple services for one encounter. You can just hit new, go to the next one. I would say most encounters you end up entering probably one. So now I'm done the services part. So the next time we see this patient for wound care, they're already enrolled. So let's pretend this is a different day now. We see them again. We go to create our new service. There's nothing in here yet. Now that they've been enrolled in the home care nursing, you just select it, and this time you do a follow-up service event. So you can select it. You'll see a lot of this information will fill in for you. Again, you can change the service event if it's, again, we did something other than wound care. Otherwise, just go ahead and hit save, and then your follow-up event is as easy as that. Okay. And it's the same kind of deal with the discharge event. So again, maybe a couple weeks, months, whatever go by. We have our last visit with the patient. The wound looks good. So again, in that encounter, so again, let's say this is a month ahead in the future. We're going to do a progress notes, our measurements, and then we're going to enter our discharge service event. So we're discharging from this service. They no longer need it. So again, I would hit new. And this time, again, still select our service episode, and we're going to choose discharge service event. And you'll notice here it'll actually go right into the stop date. So I'm just going to do Control T because today's the last date, and then you want to put in your stop reason. And again, this is another area you want to choose from the ellipsis. So here's all our different stop reasons. I'm going to say they completed treatment, so I'm just going to select that, hit OK. And you also want to do a health issue for the discharge events. You don't have to do them for follow-ups, but you want to do them for the initial and for the discharge. So again, I think we just did wound, and we did, okay. And then we're just going to save it. Other features that you have in those windows, so if you want to edit something, you can just hit edit to the right. You have the view history button in the bottom right-hand corner. And that's again going to show you each service event that's happened, the date it happened, whether it was an initial or a follow-up or the discharge. And even gives you a hyperlink to take you to that appointment. So those are your services. And the last thing I'll just mention is about one-time service events. So if you have a case where this isn't going to be a recurring thing, it's just a one-time service, you still need to do a service. Do not use this option here called one-time service event. It's currently not working properly and it's not going to display properly in the chart. So if you are doing a one-time service event, always just choose initial service events. Fill it out as usual, but you want to include your stop date. So again, we're starting the initial and stopping it all in one go here. Add our health issue. Okay, and save it. So there we can see it will say initial, but we've also end dated it. So that's counting as a one-time service event. So again, just to reiterate, do not ever use the one-time service event. If it is a one-time, just use the initial and end date it all in one step. Okay. Next, we're going to move on to the encounter summary. This is just going to give you an overview of everything you've done in this visit. So here's all my progress notes. Here's the measurements I took. So it just kind of keeps a running tally of the things that we've done during this visit. We're going to move on to the encounter forms. So to see the encounter forms, we're going to go to the new form button. Now what this is we're basically going to look at something in here called dynamic forms. And the example we're going to use is the substance use history form. So when we talk about dynamic forms in MOIS, basically they keep a running history of each time they're filled out. And as you fill out a new one, you can actually see the previous answers that were given the last time that assessment or that form was filled out. Okay. Now this one I have selected here, the mental health and substance use history form. This is mandatory, part of the mandatory core data set for mental health. So if you are working in mental health, this is something that needs to be done. Usually it's done at least during intake. So it's not something that has to be done during every single visit, but it is something that should be done at least once, or if anything changes with that person's substance use, it should be done again. So I'm going to select substance use history. I'm going to hit create form. And here's what our dynamic form looks like. So here on the left, I have my answers I can check off. Okay. And you can see here to the right, the last time this form was filled out was September 25th, 2019. And before that, we did it on the 23rd. And you can see the answers that were given to each of these questions. So you'll notice as well, if you check off certain things, sometimes it will expand and it allows you to add additional information and details about that use. With dynamic forms, when you have finished filling them out, you want to go to the bottom right-hand side here and save them and also sign them. What signing does is makes it read-only for other users. It's a best practice thing. It just kind of makes that read-only and putting that it is actually a completed form. So I'm just going to hit sign. You'll notice now it says this form is locked/read only. If you need to make changes to it, only you have the ability to do that, but you will have to unsign it first. So now you can see the sign form has turned to unsigned form. So you can select that. You do have to put in a reason, so maybe you are adding more information, unsign, and now I can go ahead and enter in the information I want. Again, hit save form when you're done and then sign it, and then we're going to go close. Okay, so there I have that completed dynamic form. Now you'll notice there's a huge list of other forms in here. There's a lot of ones that public health does use, so different types of assessments for child and youth. So if you are working in public health, you might see those. And then you also have things like forms for like a TB skin test administer and a TB skin test read. So those are separate, obviously, because they're going to happen during different visits. And again, if you open one of those up, the same kind of format, just different questions. And to the right, we have our previous answers that were given the last time this was filled out. So those are your dynamic forms. All right, so other things you can do from this window. So we're going to navigate up to the top here. So we have save. Next to save, we have chart views. And this allows you to open this patient's chart and go directly to a specific folder. So like I mentioned near the beginning of the training, you can do a lot from Scheduler. You can even navigate directly to the patient's chart from here. We're going to do that in a second. I just want to talk about the action. So action is where you can do things like create a referral, different requisition orders. You shouldn't have to do any of those. You can also do things like create tasks and messages. So I did briefly mention tasks and messages when I talked about Workspace a little bit. This is one of the many areas in MOIS where you can create a task or message to another MOIS user. And you'll also notice to the right, if there's a shortcut key for something, it'll display to the right. So I'm going to show how to create a referral. So if you need to refer this patient to another service, we're going to go create referral note, or you can do just Control-R on your keyboard. And this is going to bring up the referral window. Key things to remember about creating referral. The description has to be chosen from the coded list here. So don't type in a description of what the referral is for, just click on the ellipsis and choose from this list. And again, we really recommend choosing the NH, the Northern Health custom codes. A lot of these other code sets are things like diagnostic type codes. So maybe if I want to refer them to a social worker, to on another team, you could do, there's one here for clinical social worker, or you can also search here. Double click to add. Okay. Next, you want to make sure that you put in who we're referring them to. And again, you generally don't want to free type in here. You want to click in the ellipsis. Now, this list is going to include what we call our internal lists. So if who we're referring them to is working in Community MOIS, so say I'm referring them to the ACT team, and the ACT team is using Community MOIS, I could actually search for ACT, and you can see you actually have the ACT team that comes up. So when I send this referral, it'll actually go into the ACT team's workspace in Community MOIS, and then can be triaged from there. Now, if we have an issue where we're referring them to a service that is not in Community MOIS, we're going to have to go about that a different way. Now, other things this includes is the external provider list. So there's things like external means outside of this instance of MOIS, so it'll have like all the physicians in BC. It might have some locations or clinics. If there's something missing from that list that you need to refer to, that it is again something you might want to bring up to the team lead and see how they're handling those. But generally, yeah, you just want to select from this list. And generally, if you are doing it within MOIS, you want to refer to the team, or the org as we called it, not to an org role, so to a specific person. So generally, all service requests go through to the team rather than to an individual on the team. Okay, so I'm going to select PCFT1PRG. The referral notes section here, you can type something in here. It's not mandatory because you have to go and choose a referral letter anyway, and you can add all that information there. But if you want, you can do that. I'm just going to type in something in here so you can see where it shows up in a letter. To see social worker. And next, we want to hit create referral note. Okay. Now this brings up a list of all our referral letters. Now again, if you're in Community MOIS, you're going to see a lot of different referral letters here. What's nice is once you start using the forms list, your most recent ones will show up in the top section. But when you first get started, you're going to need to search. So again, a good thing to ask if you are doing referrals, what form that you actually use. For the purposes of training, I'm going to choose this generic one that's just called our 2.22 test referral. I'm just going to double click on it and it's going to load up this letter. Now, some letters have this little letter setup built in where you can choose items from this patient's chart to include in the letter. So you can see here, by default, the patient's long-term meds list, allergies list, health issues list are going to show up, and other things I can actually choose. So they have 453 measures. Likely I don't want to include every single one of those, so I can actually choose the records and just check off what I want to include. So I'm just going to check off a few things just for the sake of showing them. Hit continue. Now you can see on this list I have 4 selected, etc. Once I'm happy with what I'm including, I'm going to hit continue. This letter is designed to pull in my progress notes from today, so I can actually choose which progress note I want to include. Again, not every single letter is going to do this. It really depends on the setup. And from here, it's like a Word document. So anything in orange, this is information being pulled from the patient's chart, things like demographics. This little blue highlighted area is being pulled from that original referral window. And again, not every single letter is going to be set up to do that. And then we're going to have these tables that form based on, again, the tags, like whatever we chose to include with this letter. So from here, you can type into it, you can add information. Here's my progress note that got added. You can add additional information down the right-hand side, additional tables. Just be careful when you paste things where your cursor is, because wherever that cursor is, that is where it's going to populate into. So if I added something here, I hit paste provider data, and here's my provider list. Again, it's going to go directly where I want to paste it. So once you're done with that letter, you always want to, of course, make sure that you save it. And you have options here. So again, this depends on how your clinic flows. A lot of times it's the clinician's responsibility to create the referral, and then they send a task to, the clerical staff to maybe format it, send it off, fax it off, whatever is necessary. So I'm going to do create task right from here, and I'm going to send it to our clerical staff to send off. So create task, again, hotkey Control K if you prefer to use that. Here we're going to choose who to assign it to. Now for clerical staff, again, it depends where you work. Generally, you're not going to send this to somebody's name. You're going to send it to an org role. So there are some PCA org roles. Let's see what we have in the test environment. So maybe we're sending it to the PCA org role there. And you might also be in a clinic that uses what's called user groups. This is kind of the old version of org roles before we had that. This was kind of the way of grouping users together. So again, just, ask what your kind of policy is, what you're doing, whether it's user groups or the org roles or orgs. Priority you can change if you want to, otherwise it defaults to medium. Due date is the date that I would just leave it as the current date. It's not going to change when the person gets the task. It's just going to change the date that it is going to flash at this bottom section here for the notifications. And we're just going to type in the task. So I'm going to say, please fax referral. You can see it's linked to this letter. It's linked to this patient. So whoever is receiving this knows which letter I'm talking about, who I'm talking about, and they know what to do. So I'm going to hit create, and that's going to send it off. And from there, I'm just going to go ahead and close this window. Now, obviously, you have other options here. If you want to print it yourself, you do have print. If you want to distribute it, so if you're working in a clinic, or if you're sending it to a clinic that has something called E2E, you can actually send it electronically. And we won't get into that for just the time's sake, but basically it allows you to send this to somebody outside of MOIS without having to fax it. So think of it as e-fax. So E to E is EMR to EMR. Okay. I'm going to go ahead and close this. All right. So now we're going to move on to the chart views. We're going to get into the patient chart. So chart views, and we'll go right to the patient summary. So you'll notice what will happen when I click on this. It's going to take me out of scheduler. It's going to take me into the chart, or the patient chart, and it's going to make Betty my active chart. So I'm going to click that. So you'll notice now I'm in the patient charts, and it's taking me directly to that folder. Now it looks like my encounter window has closed. It actually is just moved to the back of the screen. So if you go to your bottom toolbar, Windows toolbar, where your MOIS icon is, you'll be able to see that encounter window is still open. This will stay open until you actually hit the little red X. So if you can move to different areas without worrying about losing that little encounter window. So this is the patient summary, just an overview of this patient's chart. You can click into these to expand or collapse. And you also have a little blue link arrow that will take you directly to this patient's, this particular data. So if I'm interested in looking at, let's see, this preference for needle phobia, you could click on that little blue navigate to record, and it's going to jump me to where that is housed in the patient chart. So now I'm in the care plan under preferences. It defaults to the last 60 days. So there's some information that will only show up within the last 60 days. So encounters in the last 60 days, documents in the last 60 days, etc. Other things will always show up here, like basic demographics. Next, we're going to move on to the demographics folder. So to get to the demographics folder, we're going to go to our left-hand navigation and click the very top folder that says demographic. Now this will take you into the main demographics tab. So you can see there are additional tabs across the top with additional demographic information. So this front page gives you First name, last name, date of birth, gender. This is where you can update the or use the advanced gender designation. So I know I mentioned with the quick registration not to try to do that there, as it will kind of crash the system, but it can be updated here. So if you see the gender highlighted in yellow on a patient chart, it means the patient does have multiple gender designations. So if you click the ellipsis to the right of the gender drop-down box, this gives you additional choices that you can make. So your administrative gender, that's used for things like billing, reports, health maintenance review. Generally not something that we change. The preferred gender is what the client identifies as. So there is a non-binary option in there if they don't identify as being male or female. And then genotypic, that's the actual genetic makeup of the patient. So generally the one that gets changed is going to be the preferred gender. You can choose to include this on the main demographics page, and you can also leave a comment if needed. Okay, so when you see that little checkoff show on demographics, it means it shows up under this heading here called selected items. So you can see here gender preferred is male. Okay. The next section we have is their address and contact numbers. One thing to keep in mind, if you do need to update an address or a phone number, you just want to make sure we archive the old one before deleting it and putting a new one in. So we have this button right below that says archive address. That's going to stamp this into their address history. So I'm just going to select that. I'm going to click OK, and now I'm free to go ahead and make any changes. So maybe their phone number has changed. I can do that. Address, etc. Again, keep in mind with address that the top address should always be their mailing address if it's different from their physical address. At the bottom here, we have short notes and general notes. So any general notes about this person's demographics. This should not include anything like diagnostic information or sensitive information. Over to the right, we have their insurance number. So again, where their BC PHN should go. Keep in mind that if they do not have a BC PHN, you can use other province IDs. But if they do have a PHN, that is what should go into this main field here. Okay. Bottom section, again, selected items. So this is just pulling from other areas in the chart. So there's other areas that you can check off a little box that says show on demo or demographics. And this is where it shows up for easy reference. Next, we're going to go to the top to the next tab over from demographics where it says patient detail. Now this is where some of the core dataset values are entered in for mental health, as well as home and community care, and I believe public health enters some of this as well. So one thing that is collected here is AAI, that stands for Aboriginal Attribute Identifiers, and this is where we can put in if the person does identify as First Nations, Métis, or Inuit, and if they have status. So for the home care data set, as well as mental health core data set, we need to gather the ethnicity. This is one area where, again, there is a search list to pick from. And again, just to stress that we always want to choose from the coded list. We do not want to free type in here. It's not going to be coded, and it's not going to be able to be pulled on any reports. So here, if we just say this was blank here, you have a search line up at the top, and we can search for, so one of the questions that's asked for ethnicity, or do you identify as being Aboriginal? And if they say yes, then we can ask, are you First Nations, Métis, or Inuit? So we can search here. There are some in here that that don't have the AAI beside them. You want to disregard those. So for First Nations, there's an option that says Canadian Indian with First Nations in brackets, and the one that just says First Nations, that one has the AAI after it. That's the one we want to select. That's where the stats are being pulled from. So we're going to select. You can add multiple ethnicities. Here you can see below that. First Nation status. So this is where we're going to put in, do they have status? So if they say they are First Nations, this is where you can put in if their status, non-status, asked but not known or not provided. If they are asked this first question, like do they identify as being Aboriginal, and they say no, what you want to do is put in the First Nation status as asked, does not identify as Aboriginal. So instead of leaving that blank, we want to actually put in that they don't identify. Okay. All right. Other things that we're going to fill out for the mental health core data sets is the relationship. So this is relationship status. Again, this one's just a little drop-down list. We're going to select from just that little drop-down. We also have education level. So again, part of the core data set. Just choose from a drop-down list. And the last one we're going to do is living arrangements. And this one is an ellipsis. So if they have no fixed address, that is in this list. Here are your other options. So if they live in a shelter with a roommate, with family, again, just double click to select, and always make sure that we're saving. Okay. The address history at the bottom, so that's where they save to when we archive. And you also can put in name history if required, if they have a previous name. Okay, we're going to move on to the Connections tab. So Connections is very important and is something that is consistently used across all the groups. So when we're using Community MOIS, it can be very hard to identify which clients are being seen by which groups. So a way around that is to actually use connections to a team, connections to an individual on the team, and then there's other connections that are required here for the ministry. So again, core data set values that need to be entered. Okay, so one of the important connections that we're going to enter is the primary care provider. So here we have an example of one that's already been entered. So the connection role was primary, as in primary care provider. We have the connection resource. This just dictates what list we're able to choose from. So provider external means external to this instance of MOIS. So it's basically a huge master provider list of all physicians within British Columbia. We have a connection here that's no primary care provider, so that is also in the list as along with all the physicians within BC. So when you see lists in MOIS that say external, we're talking external to just this particular instance of MOIS. Internal would be internal to this instance of MOIS. Okay, so let's go practice entering one. So one that's commonly entered is a connection to the team. So whichever team is taking care of this client. So to add a new entry, we're going to use our new record button up at the top and fill out our new line. So for the connection role, we're going to choose the team type. So if it's a mental health team, it's likely going to be MHSU. If it's an IPT team, it's going to be probably PCIPT. So let's say we're going to connect them to Team 1 in Prince George. So I'm going to select that. Next, we're going to choose our connection resource. So team names, you might have remembered at the very beginning when we talked about orgs and org roles. So orgs are our team names, our organization, and it's internal, of course, to MOIS, so we want to use our organization internal. So that's going to give us a list of those orgs, or that team name. So I'm going to select that, and now again I'm going to, instead of typing, I want to click on the ellipsis, and we want to search for our team. So if I go PCIPT 1 PRG, there's my team here, double click to add, and then always it's best practice to put in the date that connection started. So I'm just going to use today's date. Again, hotkey Control T we can use for today's date, and then we're going to go ahead and save it. You'll notice little checkboxes to the right here. Show on demo just means it's going to show again on this main demographics tab under selected items. And the care team member means it's going to show up in this person's care plan that they have a connection to Team 1. So none of those boxes are mandatory, but just have an idea of where those populate to. Another really common connection is to an individual on the team. So let's do one for, say, my org role, which I have PCIPT 1, Nurse 1 PRG. So we're going to do another new record. We're going to still choose PCIPT because I'm a member of the IPT team. And this time I'm going to choose org role internal. And then I'm going to click on my ellipsis. And I'm going to search for Nurse 1 PRG. There it is up at the top. Double click to add. And then again, make sure we put in our date. Now it's really important to put the dates in because a lot of clients are kind of in and out of different services. So if I, as a healthcare clinician, look in here and see a whole bunch of different connections, and I'm not sure which ones are still current, the start and the end dates are really going to help out with that. So again, something that's commonly done after this person is no longer seeing this IPT team is someone has to go in here and put an end date on it. So that's another thing, kind of a recurring thing we do in MOIS. We don't delete things, we end date them if they're no longer current. Okay. Other common connections. So let's say we're doing connection, again, let's talk about AAI. So if the person says they do identify as being Aboriginal and that they're First Nations, and if they, the other question was, do they have status? The other two questions are, do you normally receive, or do you live on a reserve? If so, which reserve and where we would enter that. And then the second question is, do you normally receive your health care on a reserve? So those are going to be two separate connections. And the reason for that is, again, stats, we want to collect stats on how many people who actually live on reserve are normally receiving healthcare on the reserve versus coming into town and getting their healthcare at another place. So to enter the reserve, I'm going to, again, do new record. I'm going to choose the connection role FN, so FN Reserve, First Nation Reserve. This one's nice because it automatically defaults to the organization external list, which is again a list of a bunch of organizations like schools and reserves that are external to our MOIS instance. And now if I click on my ellipsis, so I'm going to say maybe this person lives on Blueberry River. So I'm going to search for Blueberry. Now you'll see here I have two options. You want to look at the organization type. So if we're entering in the First Nation Reserve, we want the item that actually says that it's First Nation Reserve. So I'm going to select that. Again, it's always best to put in a start date. And our second question for AAI that's entered in here, do you normally receive your health care on a reserve? And to enter that, again, new record, and this time we're going to use what's called ABORG. That's short for Aboriginal Organization. So that's in reference to a healthcare center on reserve. Okay. Again, it's still going to be in the same list. And again, we want to make sure we look at the organization type. So if I search for Blueberry this time, you can see here, I want to select the one that says Aboriginal Facility. So that's the actual clinic. So again, I'm going to go ahead and add that. Okay, other connections that are entered, any education engagements. If this person is receiving mental health services, you need to enter if they are attending a school. So that could be elementary, middle schools, high schools, colleges. Those are all available. Again, just new record to create them. Choose the type of school. So there's college in here. There's middle school. There's elementary. So if I do, let's just choose university. Again, this is part of the external organization list. Maybe they go to UNBC. Okay, so there we go. University of Northern British Columbia. Okay. Okay. There are a variety of other connections that can be entered in here. We won't go through every single one just for the sake of time, but those are kind of the main ones that are entered and that are required. So we're going to move on to go over to the tabs here to associated parties. This is where you can enter emergency contact or next of kin. So you can see here we have the person's name. So this is Jane. This is this person's daughter. Role. So there's a bunch of family roles as well as things like power of attorney, trustee, etc. And then you have your contact number here. And you can enter in additional information in the bottom section. And again, it's the same process as usual. If we want to enter one, new record. If it's a free type in line, you can go ahead and do that. The role is just a drop down, and then you can type in your information here. If you want to show it on the demographics, you can have that checked off. And if you want that contact to show up on the care plan, you can check that off as well. Okay. Occupation. Now, entering occupation is required for mental health patients. So there is a variety of occupations in here. Again, new record to create them, put in a start date, and then click on the ellipsis and choose from the description list. There are things in here like self-employed. So if we do self, you got self-employed, you have unemployed, retired, homemaker, and then there's a variety of other options in there. So I'm going to say that this person is retired. Double click to enter. Go ahead and save it. And again, if you need to make additional information or add additional information, you can do so in the bottom field. Moving on to, we'll go to benefits, which is the last tab over here to the right. And this is where things like medication coverage and temporary rate reduction can be entered. So Plan G, any other medication coverage, that is, again, part of the core data set for mental health. And temporary rate reduction, that's something that is added for home and community, or home care. Here's one we have, so you can see that they do have a Plan G in here. If I just double click on it, it's going to let me view the details. Okay, and if we needed to add one, you need to click the new button over here and then choose what we're entering. So if we're doing a rate reduction, you can see if you expand this, we have the one option here. Any other extended benefits, again, you can click into them to expand. Double click to select, and then just fill out the required information. Okay. Again, this is another area that can be added to the demographics as well as the care plan. Okay. And that is it for the demographics tab. So we're going to go back to the left-hand side and go to the next folder down. This is the encounters folder. So as soon as an appointment is booked for somebody in the calendar in this instance of MOIS, it creates an encounter on this patient's chart. So this is a really nice way of seeing all their appointments that they have had in all the different clinics that are using, say, community MOIS. It's also a nice way of looking to see if this person has any future booked appointments. So any appointments booked for the future are going to show up at the very top in italics. So we generally recommend, if you say a patient doesn't know when their next booked appointment is, instead of scrolling through a bunch of days in a day book, it's just a great idea to maybe just open their chart and look at their encounters, and you can see absolutely everything that's booked for them. You can see here it is listed by the date of the encounter. It will have the hour, minute, the time, who it was with, so what the day book it was booked under, as well as the visit reason. And all of these can be filtered. So if you're looking for a specific visit that's booked with a certain calendar, you can click under that provider section here and say, I just wanted the ones that were booked under my org role. I could enter that here. Double click to add, and now you can see the only encounters are the ones that were booked with my org role or my day book. You can do the same thing for visit reason. You can type in visit reason and look that way. To go back, you can just cancel it up here, go delete, and now I'm back to everything else. Now, if you want to see what was done during a previous visit, you can just click on the appointment once, and you'll see at the bottom we have what is called the encounter summary. So you can read all if there were progress notes that were made, any measurements that were taken, anything else that was done. We've got a prescription here, a lab requisition, and a consultation. Okay, so that gives you a nice little overview. You can also open up the original encounter window. So if you double click on the encounter window here, oh, I already have it open, that's why. So we'll close that. So if you open up, say this one here from May 13th, so there you can see it's read-only since it's been past 7 days. My progress notes are read-only, and I can view them here. So that's your encounters folder. So we'll move back to the left-hand side, and we're going to click on measures. So this is a repository for any type of measurement that's been taken in all of those encounters, as well as things like lab work, if the person had lab work ordered out of MOIS. So this isn't, I just want to clarify that this isn't going to be a complete list of every time this person has had lab work. It's more so if the provider who ordered the lab is receiving their lab results in this instance of MOIS, then you would be able to see them, if that makes sense. Okay. So here you can see, again, the most recent are up at the top. Here are the ones I entered today in today's encounter. You can search for a measurement if you want to see like the last time we measured their glucose. You could type in glucose and hit enter. There's all their glucose measurements. You can see who collected it, the test name, the value. And the bottom half of the screen here is what we call the detail window. So things like more detailed information, reference ranges, report, comments, that kind of thing. Okay, so we don't want to create measurements through this window because we want them linked to the actual encounter. So you always want to make sure, I'm just going to bring back today's encounter. You always want to make sure you're entering them through an encounter so it's linked to an actual visit. If you just enter them into the measures folder, it's just going to be in the measures folder and not linked to a visit. Okay, so use this as a read-only tool. You have the same options that you have in the encounter window. If you do a right click, you do have the show history feature where you can pull up a complete history of each time that test has been done. And you can still graph things here. You have graph at the top. You can also do your right click and send a task or a message from here as well. Okay, we're going to move on down to allergies and intolerances. So the important folder here is the reaction risks folder. This is where you can view any allergies that have been entered for the client. And if you need to enter an allergies, this is where you would do that. So right now you can see we have 2 drug allergies entered. We have one for penicillin with the reactions of itching. We've got one for sulfa drug with nausea and rash here. So if you need to enter in a new allergy, we're going to again use our new record button located up at the top. We can choose our reaction type. So is this an allergy or just an intolerance? The agent type. So is it a food allergy, an environmental allergy? There are 2 drug lists that you can use. There's drug specific, which will be a list of different dosages, different flavors, different brand names. And then you have category, which is just your very broad term. Like if, say, we're doing a reaction or an allergy to Tylenol, drug specific is going to give us probably 100 different options with different dosages and children's grape flavored, however many milligrams. Drug category, the closest thing we're going to have to Tylenol will be acetaminophen. Okay, so you can choose either. Next, we want to go to where it says agent, and we're going to click our ellipsis, and this is where we're actually going to search for the drug. So I'm going to click the ellipsis. This is my drug category list. So again, this is my broad list. So if I search for acetaminophen, here we have our acetaminophen containing compound. So I'm just going to double click to select that. Next, we're going to enter in our reactions. So there's 3 spots to enter 3 different reactions here. If there are more than 3 different reactions, you can add more after saving this initial little template. So again, make sure you click on the ellipsis. You do not free type this in here. We want to choose from the list, so it is coded. So I'm going to say maybe one of the reactions is they have dizziness. So there we have dizziness, and maybe they also have some nausea. So we're going to search for nausea. Again, double click to enter. Severity, this is optional if you want to enter severity, and comments are also optional. From here, we're just going to go ahead and hit save or F2 on your keyboard. Okay, so there is my allergy. After saving, you're not going to get that initial little template pop-up box again, but if you need to make modifications, just click on it once, and the bottom detail window is where you can make your changes. So say if I wanted to add another reaction, I can click the Reactions tab, New Reaction, click my ellipsis, double-click to add, and then we're going to save it. Okay. Other features we have in this window. So if they have no known allergies, so this is blank, we've reviewed with the client, asked them if they have any drug allergies, and they say no. There is a button here up in the top toolbar that says no known. It'll only allow you to select this if there is nothing in this window. So even if there was a past allergy that has been end dated, it still is not going to let you use the no known button unless this is blank. Okay. Next to that, we also have the review button. So you might have noticed here in the heading where it says reaction risks, I have a date, 2019 11/17. That's the last date this list of allergies has been marked as reviewed. So basically saying that it's up to date. So say if you talk to the patient, they've confirmed that these are their current allergies and there's no changes, you can click the review button. You can put a note if you want to. It's not necessary. It shows you a history of the other users who have reviewed it. I'm just going to say mark reviewed. And now you can see the date has changed to the current date. So the next person that looks at this can see that it was recently gone over with the client. Okay. So that is the allergies. Events, we won't go into much here. What this is used for is adverse events. Generally, for adverse events following an immunization. It's something that you will not have to do as a student nurse, but if you need to look something up here, it's basically we'll have what was the agent that was administered and what the reactions are. And again, at the bottom is where you have your more detailed information. Okay. Okay, let's move on to the long-term meds. So the next folder is their long-term medications. Now, again, much like with their measures, their lab results, this isn't going to be a complete list of this patient's medications. This list is only as good as what clinicians are actually entering in here. So it does not link to PharmaNet, it does not link to other systems. Okay. Just to clarify, I know that people get confused about the long-term meds list and the prescriptions list. The difference between the two is prescriptions is generally used for things that are short-term, things like antibiotics, trial doses, that kind of thing. And long-term meds are things that the patient is on from a mid to long-term basis and are entered at the clinician's discretion. So if you need to enter in a long-term medication, we're going to click the new record button up at the top. We're going to put in the start date, so that when they started taking it. It can be an estimated date, or we can just do today's date. And next we're going to choose the medication. So again, we want to make sure we're not typing this in. We're going to click the ellipsis between the code and the medication. Okay. So here you can see you can filter by generic name or by brand name. So if we look for, let's look for paroxetine. So again, note that a lot of these are dose specific. So I'm going to we'll choose this one here. Okay. And then next we want to enter the dose and frequency. And to do that, again, we want to click the ellipsis, and this gives us our little template. So you can do like 1 tab. What I'm doing is just pressing the first letter of the choice that I want to drop down the list. So if I just hit O on my keyboard, I get oral, or you can expand and just enter in and select from the dose there, the dose units. You can do milligrams as well, so keep that in mind if you're not doing tabs. So you do have options. So if I want to put in that they do 30 milligrams, I can't enter that. Okay. And then we're just going to go to the bottom of the page and hit save. Now, if we ever have a dosage that changes, so they're no longer taking something, again, just make sure that you don't delete anything out of here, but that you'd put an end date on it. So, for example, let's say that they're no longer taking this vitamin D here. We'll just go to the end date, do Control T, save it, and you can see it's grayed out and we know that they're no longer taking that. Just like with the allergies, you do have a no known button and a review tab. So if you want to review their allergies and mark that as reviewed, you have that same option here. And no known if they have nothing in here and you just want to record that they don't take anything. Okay. Okay, let's move on to the MAR. So MAR stands for Medication Administration Record, and this is where any point of care medications for the client are being recorded. So in community MOIS, you'll see a lot of things like maybe antipsychotics that the patient comes in for and gets administered to them in the clinic, and also probably a lot of vaccinations. So public health does use this system to document vaccinations. So here you can see anything that's been documented. It's grouped by the medication. So if I click into here to expand, you can see the different dates of administration. If you want to look at the details of one of these records, simply double click on it and it will give you the complete details here. Okay. So if you need to enter in something into the MAR, the first thing you want to do is go over to where it says active encounter. Right now it says no encounter and we need to select the date that we gave this. So if I just go over to new, it's going to tell me new records require an associated encounter record. So because we gave this person to them in the clinic, that means we must have had a visit or encounter, which means it wants us to select the encounter where we gave this. So click the ellipsis. Here's my encounters list. Here's the date that we gave it. We're going to hit continue. And now when we hit new, our options pop up. So we have the option to administer medication, record medication history. That's if you're entering in historical vaccines, and generally clerical does that, so we won't go over it now. We're just going to show how to do administer medication. We're going to hit continue. Now you'll see here automatically your username is going to fill into the given by, and it will put in the current date and time. So just keep that in mind that this should be the date that you actually gave it. So if you're doing back data entry, maybe you did a vaccine at the end of the day yesterday and you haven't had a chance to enter it today, just make sure you change it to the actual date of administration of this. To enter in, we can either choose by medication, or if it is like a public health vaccine, you can choose by lot number. So public health vaccines are regularly updated and put into community MOIS. So if you're using community MOIS, you give a vaccine, you can search by the lot number field. So I'm just going to search in lot number, and maybe we did AH, and it is case sensitive. I'll just mention that too. HBV, select, and you can see here the medication fills in for me as well as the dosage. If it's something else, so it's not a public health vaccine, or you cannot, or it just doesn't have a lot number, which is the case with some medications, we're going to choose by the medication. So we're going to click the ellipsis, and here we can search for whatever the medication was. So maybe we gave clozapine. I'm just going to search for that. Okay, and maybe it was 25 milligram tablet. We're going to select that. And now we're just going to fill out the rest of the information here. So our dosage, let's just put in, we did 25 milligrams. Oral, site would be mouth, or oral, there we go. Reason, a lot of these reasons, keep in mind, are for vaccines. We're going to put in because this is what's prescribed by the doctor. And if consent, again, if this is required to document consent, make sure you put that in. Again, it's not always required depending on what we're entering here. If it's a series, so it's a dose number, again, that's usually more pertinent to public health vaccines. If this is dose 1 or dose 2 or whatever, make sure to enter that. And then you have 3 sections for notes. So administration note, just anything you want to document about the administration of that medication. Preparation, if you had to prepare it in some way. And consent, if you want to put in details about who gave consent or anything like that. And then we're just going to go ahead and hit save and close. If you gave multiple medications, you can, on the same day, you can use the save and duplicate feature, which saves this and then gives you another blank screen but with the same header, so we can quickly go in and enter the next thing that we administered. So we're going to say this was intramuscular and left arm, routine, vaccine. Yes, we had confirmed consent in person by the client. And maybe this was dose 2. And then save and close. Only the person who has created the record will have the ability to modify it. Okay, so just keep that in mind. Double click to open it. Only the person who has created it is going to have the ability to modify. Okay, we're going to jump down to social history. So social history, this is required for mental health clients, and there are just a few things that are entered or need to be entered in here. So if I bring up the list here, again, this is a coded list we want to search from. Okay. So here we have things like, let me just do, so things like currently has children in the care of others, if they have children they're providing care to, currently is providing care. So this is our category called MHSU. So maybe I'll just filter that to MHSU as my category, and I'll show you the ones that are required to be entered for mental health clients. So the other things that are entered are anything to do with incarceration or any interactions with the criminal justice system, as well as if the person has recently experienced violence. Okay. Double click to enter these. Again, always good idea to put in a start date and save it up at the top. Okay. Moving down to the documents folder. So I would just like to touch briefly on this. So you'll see a lot of attachments in MOIS show up in multiple different areas. The documents is going to have all the attachments on the chart. So it's a good place to come look for if you're looking for some kind of document or attachment and you're not sure which folder it's been attached to. They should all also pool into the documents folder. It's also a searchable list, and an attachment is dictated by this little 1 or 2 under the paperclip symbol. So you'll see the paperclip symbol a lot in MOIS. If it's blank, that means there's nothing attached to the record. If it's 1, it means there's 1 attachment. If there's 2, it means there's 2 attachments. And if you want to view what that attachment is, you can simply just double click on it, and it's going to bring up whatever that attachment is. So this one was our referral letter. Okay. Next, we're going to move on to health issues. So health issues, this main folder gives us an overview of any health conditions, health risks, and health needs that have been documented for the patient, and also gives us hyperlinks so we can jump directly to any of these records. To actually enter anything in, we need to go into our subfolders. So the conditions folder, this is where we can document any health conditions the patient has. Again, you want to make sure you put in a start date, even if it is an estimated date, and you always want to choose from the coded list. So here we can see a list of this patient's health conditions. You can also end health conditions. So you can see there's one here for a wound that they had briefly. They also have one for tobacco dependence. So this is where you can identify someone as being a smoker. So smoking, any tobacco dependence goes in as a health condition. If you want to put in how much they are smoking, that goes in as a measurement. So what we can do is we want to enter a new one, again, new record, put in a start date. Again, it can be an estimated date if they're unsure of the date they were diagnosed, and click on the ellipsis to search from the coded list. So maybe they also have anxiety. Again, double click to add, and then we're going to go ahead and save it. Other things you can add, there is a certainty and a severity drop down. So if it hasn't been confirmed that they have something, but it is your impression, there actually is an option to say that it's an impression that they have an anxiety disorder. There's also severity, if again optional if you want to add severity. And there's also a ranking system. So basically number 1 means this is kind of, at this moment, that is their biggest concern, or whatever condition requires the most attention at this moment. And again, that's an optional thing that can be added. If a health condition is no longer current, again, we don't delete it. You would want to make sure that you actually put in an end date for it. If you want to add any comments, you can do that at the very bottom of the detail page. Next folder we're going to move on to is risks for conditions. This is where you can document any conditions this patient is at risk for but does not currently have. It's also where, for public health, they're putting in if the person is or does identify as Aboriginal. So that's the option here where it says special population, general Aboriginal ancestry, and that's just, again, documentation that goes along with offering the Hep A vaccination series, and again, for collecting stats. We also here can see that we have a risk that says lung cancer, and in our comment we have exposure to asbestos. So again, probably not something that's going to be filled out for every client, but definitely can be a helpful tool to use. We'll go on to the care plan overview. So there's this main folder here. This is our care plan. This is an overview of everything in the care plan as well as other selected folders. So it works just like the patient summary where you can expand or collapse these to view additional data. And you do have the hyperlinks to the right to take you directly to a specific area in the chart. Okay. Preferences. So the next folder down is preferences, and this is a very important folder. A lot of different things can be contained here. So things like consent. So here we have consent for the automated call service. That goes along with Infinite Voice. So when I talked at the beginning about the automated appointment reminder calls when booking the appointments, in order for the patient to get those calls, they have to have this preference set to allow. So right now it's set to not allow. So even if we do book an appointment with that little automated call service location, this person doesn't have the preference to allow it, so they're not going to get the call. So say maybe we ask this person if they do want to receive the calls, we can simply go to the bottom of the screen here under instruction, and we can set it to allow and save it. Okay. There's also other consent that have been added. So one that's pretty recent is consent for virtual care. So again, if we're doing consent for things like phone visits or Skype visits, that kind of thing, there is consent for that. This is also where things like risk assessments are located. So you can see here we have a violence risk assessment, and the instruction or the level is high. So they are high risk for violence risk. The risk assessments are put in here because there's actually reports that can be pulled on this patient and your whole client panel to see which clients have a high, medium, or low risk assessment for violence, for the telephone risk assessment, etc. You'll also see some of these have attachments. So you can see there's those little one. Again, this would probably contain the actual violence risk assessment form. Okay. So this is something that can actually be filled out digitally. Okay. Other things that can be added into preferences are directives. So a lot of different types of refusals. So if they're refusing a service. So again, you'll probably see a lot of that because public health uses community MOIS. So things like vaccine refusals. Other things that are added in are the Mental Health Act. So here we can see they have a Form 5, they've got a Form 20, and again, we probably have the attached documents there. Preferences is also where we can find disclosure agreements. So you can see here we can see they have a release of information. Again, probably a signed document that was scanned in and attached to this preference. And it can also be things like advanced directives. So things like DNRs or level of intervention. You probably see that more in the primary care homes rather than in things like community MOIS, because it tends to sit with the family doctors. But that is an option. And we even have things like a precaution. So things like we can see this patient has a needle phobia. So to actually enter in a preference, and again, I mentioned at the beginning with the visit codes for appointments that there's a lot of placemats kind of circling around a lot of the sites. We also do have placemats for preferences because they can be a little confusing to enter sometimes. Also keep in mind you can look on Confluence and find step-by-step instructions on how to enter many different types of preferences. So for this one, I'm going to say we are going to do this is a violence risk assessment. So I'm going to click my new record button up at the top here. I'm going to choose my type. So our violence risk assessment falls under consent. The subject, so it doesn't fall under consults or measures or anything like that, medications. So we're going to choose other. And where it says concept here, I'm going to click the ellipsis. And here I should be able to find all my different risk assessments. So here we have our home risk assessment. We have a telephone risk assessment. We have transportation risk assessment, violence risk assessment. So we're going to select that. If we already know what the level of risk is, we can fill that out if we haven't done the form yet. So let's say we haven't done the form yet, so we'll leave that here. Reason, generally for this type, you don't need to put in a reason for a violence risk assessment, although there is an option for other if you do want to document that. And now we're going to just save it. And now we're going to fill out the risk assessment. So there's actually a form in MOIS that is a risk assessment. I'm going to double click under the attachment field here. And because I don't have anything attached, it's going to ask me what I want to attach. And I'm just going to search here for violence risk. I should have a violence risk one. Let's do risk. Let's do this one here, intake client risk assessment. So I'm going to select that, and it's going to bring me up. We call these paper forms in MOIS. So basically it's like a fillable PDF, and a lot of them are actually programmed to pull in a lot of the client information for us. So we just have to, basically just check it off. We'll do no here, so we can fill it out. And our save, so once you finish filling it out, top left-hand corner is our save button. You can print it if you needed to, otherwise just close it. And I'm going to say we determined that they were low risk. And so now I'm going to, again, go to the bottom where I can change my instruction to low. And now I'm going to save it. So now we have that filled out form attached. Alternatively, so if you're still using, if there's a form that you use that's on paper, you can have that scanned in and create the preference all in one step. Or you can just simply create the preference, hand the paper form to clerical, and they can scan it in and attach it to that existing preference that you created. Okay, moving on. So goals. Goals can be created for the patient for a variety of different things. It can be a qualitative goal or a quantitative goal. So if it's their, they want to get an actual measure, say to a certain spot, you can enter that. If it's just something like here, like a free type in, they want to reconcile with their son, you can do what's called a qualitative goal. If you'd like to create a goal for the client, we can click the new record button here, and we're going to fill this out. So if it's qualitative, it just gives you a free type in line for a goal. So let's say they're going to make an appointment with a dietitian. Okay. You can add additional details here. We can hit close. I'm just going to go ahead and save it. So that's an example of one. If you want to do a quantitative one, if you check off this box that says quantitative, now you can choose what you're actually wanting to measure. So subject, let's do measure, and concept, we want to do, maybe this is weight. So here's all the different things we can measure. So weight, we can set a target value, so maybe you want them to be greater than or equal to, maybe we're going to say they're really underweight, People do greater than or equal to 48 kg. Perform every, so kind of this is how often we're going to measure this goal. So let's do every 1 month. Any details you want to include, you can do an expected outcome. Again, we're just going to close it and save. That's the basic format of the goals. You'll notice at the bottom half of the screen, you have additional information that you can add. There's things like sliders for patient commitment level or confidence level. You can change the settings. There's an evaluation tab. You can see, because this is linked to a measurement, the weight, that it actually gives me a list of their different weights. And you can also link this to like a health issue or an action. So if this is linked to, let's do link health view. This is linked to their congestive heart failure. Sure, let's check that off. You can actually do a link there. Planned actions. So we're going to move down to the planned actions folder. So any, action this person is going to be taking to reach their goals. It's also used for things like safety plans. So if there's a safety plan for this client or a safety plan for the clinicians, if say they go and, go out to the community to meet this client and there's some risks involved, this is generally where that kind of thing is stored. So you can see I do have a safety plan with one attached. Again, if you want to view the safety plan, you can open it up to view it. And you can add participants action. This is just a free typed in line here. Okay. All right, barriers to care. This is just a free type in line. You can put in here any barriers this patient is facing that's related to their care. So we have that the client is hard of hearing and they also live in a remote area. Again, it's just a new record to enter, start date, type in whatever the barrier to care is. Okay, let's move on to forms. So this is your forms repository. So we don't want to create forms through these. We always want to create forms through the encounter window so they're linked to an actual visit. But this can be handy if you're looking for a certain form. So this folder is the paper forms. It's all those fillable PDFs. So again, here is the risk assessment that I just did. So you can view them here. Dynamic forms, things like that substance use dynamic form we did through the encounter window. If you want to view previous ones, you can just double click on them and see all the details. Just close it. And encounter forms you won't be using. Orders. Now, orders is being used quite a bit now. It's actually what's being used to track any type of service requests. So anytime a referral comes through to a team working in an instance of MOIS, it is entered in as an order to the team for a specific service. It can also be used for self-referrals. So again, if the patient walks in and they want care for something, that still has to be entered in as a service request. Other things that will populate in here are any other type of orders. So if, a doctor that's working out of here creates a lab requisition, you can see that also populates here. So here was an order that was sent, ordered by this person, ordered to team 1, and it was to see the social worker. Okay. Now, once that order is created, and a lot of times these are scanned in and created as orders by the clerical staff, and then they're assigned to a particular clinician at a team huddle. So once that's in there, generally what's changed is the order management section located at the bottom of the field here. So the order assigned to is where it can actually be assigned to a clinician, and it should always be assigned to their org role, never to a name. So I talked a little bit at the beginning about org roles, and if someone leaves that role, how it's really easy to move a new person into that role and be able to look at all the work that's been assigned to that role rather than having it assigned to an actual username, and then it's going to cause a lot more cleanup if that person were to leave. So we can actually assign this. So if I'm assigning this to, maybe this is I'm taking on this order. Oops. I want PRG. Select. And I can even add it to acknowledge to my basket. And when we talk about the workspace, I'll show you where that turns up. So it can actually add to my basket. Anyone else can see I am the person that is assigned to that order. And the next thing that changes is the status. So changing status is very important. The default status is in process. So if you see status that says in process, basically it means nothing's been done with it yet. As soon as you create an order, that is the default status. So say if we did like a contact, we tried to contact the patient. So I would put in contact attempted. I'm going to save it. And I'd probably want to put in an office note just so that anyone else looking at this order can see why the patient hasn't been seen yet. So office notes, I can just do new here and say left voicemail on cell phone. Okay, you can see that tags it with the date, my name, and the office note. So again, anyone looking at this order can see, why the status is currently in that status. Other common statuses we have, waitlisted. So again, if the person has been waitlisted for this this service, we can waitlist them. They're scheduled. So once the initial appointment has been booked with the client, we're going to use scheduled. Assessment completed can be used after the initial assessment has been done before services are actually in place. Completed, so once we're done with this patient for this service, so we're discharging them, we would use the completed option. We have services in place if we are currently giving this service to the patient. We have refer out, so if we never actually did any services with this patient, they've actually been referred out to another service, we can use that. And canceled would be if the team or someone on the team canceled it for some reason. So maybe the person doesn't qualify for that service. Decline services, we want to use if the client declines. On hold, so if this is on hold for some reason, maybe the patient has been admitted to the hospital and we can't move forward with this. There we have on hold, and of course we have our contact attempted. The other ones here at the bottom, we are not currently using them. So that is the order management section. So if you think of this as, tracking the actual service requests that are coming in and being able to see for your team, and again, this is probably generally more of the team leads that are concerned, but it's about who's on the wait list for your team, who's currently in service, or services are in place, and which clinicians have been assigned to which cases and how many cases they have. So it is a really important area to kind of know what to do if you do need to update a status to something. We'll move on to facility admissions. So any hospital discharge summaries, ER notes, they were admitted to a facility of some type. This is where that can be added. Again, keep in mind that you're not going to get a full history of every single admission, but this area is only going to be as good as what's being entered into it. Notifications. So this is where you can create those pop-ups. So if you have like a risk of violence or someone who has active TB, or maybe they're a COVID patient, something like that. So anything that everyone interacting with this patient should be aware of, that's a great thing to create a reminder for. And that happens in this tab called notifications. So you may have noticed that little red pop-up box pop up a couple of different times when I put the appointment to arrived, and also when I opened the chart. I'm just going to reopen the chart here so you can, just to remind you what that looks like. So here is that notification service. So again, always a good idea when you have one of these come up, just have a look over what's in that list. There might be something important in there that you need to know. And never check off stop reminder here. That's not just going to stop the reminder for you. It's going to stop it for everyone accessing that chart, which could definitely cause a problem. So just hit close and then it will reopen that chart here. So if we need to create some sort of notification, we're going to click the new record button up at the top, and we're going to type in the reminder exactly what we want it to say. So maybe the client has tested positive for COVID-19. Okay. Now, it's really important to remember that just entering that in isn't going to create the pop-up. You need to go to this bottom section here and choose what we call a triggering event. So triggering events, this is when we are going to see this pop up. We generally recommend using the patient arrival, booking appointments, and opening chart. So anytime any of those activities take place, if the patient is marked as arrived, if the appointment is booked for them, and if you open the chart, that is going to pop up at us. Okay. So just again, make sure you save. Keep in mind also that if you've entered a reminder that is no longer pertinent, so maybe this person, maybe they no longer live with this violent partner, you can, again, you don't want to delete, we're just going to stop it. So I'm going to check off stop and say save. We generally recommend not to stop reminders that you haven't created, unless obviously you're absolutely sure that this is no longer an issue. Next tab over is recalls. So recalls can be used for, different types of recurring events that need to take place for this client. It works alongside a really handy report in MOIS called the recalls report. So say if we have clients and a lot of them have are under the Mental Health Act, and it's hard to kind of keep track of who is due for, their leave review. Getting into the practice of entering recalls can be really handy for the entire team. So I could basically just pull a list of all the clients connected to my team and put in this recall code with a due date or a date range, and I can see everybody who's going to be due for that service. Okay. So say if I want to do one for, let's see, Plan G renewal. Again, we're going to do new record. We're going to choose from this coded list. If there's something that your team needs added, that's something that can be requested. I would obviously talk to your preceptor first, but new recall codes, there is potential for them to be added. So I'm just going to go down and I'm going to say, let's go to our mental health ones. So maybe they have their Plan G renewal due. I'm going to put the due date. So it's due in a month. So we're going to do 2020-07. Okay. Then I'm just going to go ahead and save it. Okay, so if I pull the recalls report with that code and the connection to my team, I can see, and with the correct date range, obviously, you can see when that person's due. You can put in additional settings at the bottom. So if you want this also to pop up at you, you could check off triggering events. It's going to pop up in that same box with the reminders. Some people like to do that if someone's really overdue for something. That way, the next time they make an appointment for something, whoever's booking the appointment can say, oh, you're due for your Plan G, and then make additional arrangements as needed. You can also change the grace period. So how many days you want it to start showing up on the report before it's due. So the default is 90 days. And if you ever need to stop one of these, again, we're no longer seeing them for this, or it's no longer pertinent, you're just going to check off the stop and hit save. Again, good idea not to check those off if it's not something that's with your team. And that is pretty much it for the patient chart. So next we're going to move on to the workspace. To navigate to the workspace, we're going to go down our left-hand navigation here and click on our workspace module. Now when you first go into the workspace, it's going to show you what's called the workspace summary. And basically we'll just say how many items you have in each of your subfolders. Now for your basket, the basket is generally used to receive things like service requests. So you know how I assigned that order to myself, my org role, it shows up in my orders folder. Generally the other ones tend to be used by providers, so if they're acknowledging things like electronic lab results, that goes into their measures folder, imaging results go into imaging, etc. So as a student nurse, you generally probably won't have to deal with any basket items. If you do see something in here, so you can see I do have something in the orders folder. This is what it looks like. So there was that order assigned to my org role. As you can see here, it is assigned to a team that I'm part of, gives me patient information, and we have a checkbox. So basically things in your workspace, when you check them off, you've basically put your electronic signature on that you have seen that item and you have acknowledged it. Okay. So this is something, the basket is something that you likely won't have to deal with as a student. What you probably will have to look at is your task list and your message board. So the task list inbox, these are any tasks that have been sent to you, or if you have an org role, to your org role. It's going to have the date of the task as well as the patient name, what the task is, and the assignee. So you can see this one was assigned to myself, so it'll usually have your initials if it was assigned to your username. And ones that are assigned to a group or to an org role will have that org role in there for you. Now tasks have an acknowledge column and a complete. And the idea behind that is you can acknowledge it once you've seen it, and then once it's actually the task has been completed, we can check off complete. Okay. You have an open chart button up at the top, which allows you to open the chart of the patient that the task is attached to. Okay, so that's how the tasks work. There's also a task sent tasks box. So if you have sent a task to somebody, you can actually see that task and see if it's been acknowledged or completed. So for example, here we have one that I created. You can see at the bottom here that it was created by me on this date. And you can see it hasn't been acknowledged or completed yet. And it was assigned to this urgent virtual clinic. Here's another one that I created February the 4th, and you can see it was acknowledged by Rachel on April 20th and completed April 20th. So you can basically see your outbox and if people have acknowledged it. Inbox, the same kind of idea. So any messages that you have been sent or have been sent to a team or an org that you are part of. The difference between tasks and messages is tasks are usually you're assigning some kind of work. So a task needs to be done. Whereas a message can just be an FYI. Often it is a response back from a task. But both can be connected to a particular patient chart and stay with the patient chart. Okay. You can see here up at the top you have more options than you do with the tasks. You have reply, reply all, you have forward. You can still open the chart again if there is a chart associated with that item. And then of course you have your sent messages folder. So any messages that I have sent, again, you have the opportunity to look at any tasks you've sent. And in the sent to section, you can see if they've been acknowledged or completed. Now let's talk about workspace blending. So you might hear this term, blending your workspace, changing your workspace. When you log into MOIS for the first time, the default is to just see items that have been sent to your individual username. Now, because we often assign tasks and messages to an org role or to a team, you can see how this would be a problem if your default is just to see things sent to you. So you also want to see things sent to your memberships, to your org roles, to your orgs, if that applies. So in order to do that, we have to do what's called blending our workspace or changing workspace. So you'll see this button in the top toolbar, and this button is available in most of these folders within your workspace. Sometimes it's in a slightly different area, but it's a little button that says change W/S. That means change workspace. So I'm going to select the change workspace button. Now what this is showing me currently are the users who are sharing their workspace with me and also my memberships that have a workspace. Okay, right now I have checked off the RTUC team and myself. So I'm only going to see items that have been assigned directly to me and to my RTUC team. If I want to change that, and again, you're not going to have this many memberships. Most people only have like one or two, usually their org role and their team. So if I want to change the ones I'm looking at, I can again check that off. Maybe I'm also covering for Rachel and I want to see what stuff is sent to her. I can check that off. If I want this to be my default setup so that the next time I log into MOIS, I don't have to do this again. It's already blended with these people and this membership. I can use this little save as default checkbox. then hit continue. And now all the items in my workspace will include those checked off items. So now I can see these new tasks have appeared that were assigned to Nurse 3. So because I blended with Nurse 3 workspace, I can see those items and I can acknowledge and complete them. Same thing with Rachel's item here. So I blended with her. So this is often done, say if you're going to be gone for a while and you don't want things to kind of go missing or not be taken care of in a timely manner. You can actually share your workspace with another user and they can acknowledge things on your behalf. So I can check this off for Rachel, and you can see here at the bottom that I've acknowledged and completed it. Now when Rachel comes back, she'll see that item crossed off in her list, and she'll be able to see that I acknowledged and completed it for her. Okay, so that is what the changing workspace is. That is what the blending is. Now if you want to share your workspace with another user, you can do that in your settings. So there's a folder here on the left-hand side under My Settings. It's called Workspace. So right now I can see currently who I'm sharing my workspace with. So I've shared my workspace with each of these users. All of them have the ability to look at my workspace items and check them off on my behalf. And on the right-hand side here, I have workspaces that have been shared with me. So just because, so keep that in mind, just because you have shared with a user doesn't automatically mean that you can see their workspace. So here are the users that have shared with me. So if I want to edit my list, because I can only control who I'm sharing with, I can click this little edit button up at the top of the screen, and this is where I can maintain my list. So say if I want to stop sharing with somebody, I could select them, hit the delete button, whoops, hit delete. Now Charlene will no longer, once I hit apply changes, no longer will be able to see and acknowledge my items. If I want to add somebody, I can click the new button and then just click in this user account field and search for the username. So say if I want to share with Amaryllis, there we go, double click to add, and then hit apply changes. And now Amaryllis will be able to blend her workspace with mine. So again, these might not be something that you might not have to share your workspace, but again, it is nice to know, especially if you say do get tasks or messages assigned to you, and maybe you're going to be gone for a little bit. And that is the review of the workspace. So that basically concludes everything we need to go over. I'll just go over real quickly what a basic workflow would be like. So again, we started off at the beginning selecting our org or org role that we're working under. We went directly into the scheduler. We went to the daybook folder to get to our daybook. We booked an appointment. We viewed our appointment. To start charting on someone, all we have to do is double click anywhere on their appointment line. That brings up their encounter window. We want to do our scene and our discharge times to track our hours of care. So maybe I saw them from this time to this time. Again, if this was today's date here, I'd have my timestamps. We did our little progress note. So F4 on your keyboard for a template. Or just type in. Measurements to enter in any of our measurements. We used a template for some of our more common ones. Save them to add. Services, so we entered our service. So again, new record. So this person doesn't have any services, so we would have to create a brand new initial one. So this is, let's say this is for case management. And today we did cognitive behavioral therapy. So I'm going to go to master lab code. Cognitive behavioral therapy. We're going to add our little health issue, and keep in mind that those health issues are not required for follow-ups, but they are for our initial and our discharge events. Save it. There's our service for today. Encounter summary, if we want to overview what we've done so far. Encounter forms, so that's where our substance use form, which is required for at least for intake for mental health services. Again, our dynamic forms remember that they keep track of what we did previously. Go here. Save and sign. Again, signing just a best practice. Close our form. Okay. Action if we need to do a referral. If we want to send a task or message. Chart views if we want to go directly into the chart. So maybe I need to check some demographics. So now I have that chart open. My encounter window is still open. It's simply moved to the back of my screen. So I can go to my bottom toolbar, click on my MOIS icon, and see that I have that still open. Once I've done everything I needed to in the patient chart, again, we always want to make sure that we do our discharge time from the time that we stop seeing the patient. Make sure you give it a save, and then we're going to simply close it. Now I'm going to go back to my scheduler. You can see here Alfred is now has now been marked as discharged. Okay, and we can move on to our next client. And that's just a really, really basic workflow that's typical for a clinician. So that concludes the video. Thank you so much for watching. If you have any questions regarding this, you can contact the training team through the help desk. Have a great day and good luck with your MOIS usage.